All right, so welcome to the Frontline Nursing Podcast. This is a NurseMinder production that gives you an insider's look into the daily life of nursing from those who are currently working on the front lines. Whether you are considering nursing as a profession, you are a student already, or a nurse in transition looking for a new patient population, this show will give you some behind-the-scenes information to help you guide your career. Now, on today's show, we are joined by Jody Belcher. She actually started her nursing career 3 years ago working in a surgery float pool and is now currently working in women's and postpartum. Welcome to the show, Jody.
Thank you.
So excited to have you here, as I am with every guest, but it's so nice for me to catch up with past students.
Yes.
And see where their career has taken and how it's evolved and what things have informed them along the way. So let's start with just finding out your nursing journey. What brought you to nursing as a profession?
I always had a desire from the time I was younger to be a nurse, but then of course life happens and I got married and I had children, and in the process I spent 20 years in retail management. Tons of companies I worked for in management, and then I went through probably, I want to say about 13 months. I lost 4 family members in a matter of 13 months. And I was kind of struggling in my retail career. And I thought, my kids were getting older. They were in school. And I thought, if I don't go back now, I'm never going to do this. So I thought, you know what, now's the time. And I was scared to death, but it was amazing. And I've never looked back. And we were talking about it being 3 years, and it feels like it's been like 5 months some days.
Isn't that true? That is so true.
Very.
Yeah. So I knew that when you came to school, you were a mature student in a sense. You had life experience behind you already, which not every student has that. But I didn't realize it had been 20 years in retail. So that's quite a shift. So you had this longing for a really long time. What was it like coming back to school as a mature student, quote unquote, mature student?
At first it was terrifying, just because I thought, like, I'm not going to relate to anybody. Everyone's so much younger, but it so was not that the case. Like, everybody was very welcoming. I met other mature students that were my age, and one's my lifelong, friend now who lives in Nova Scotia, and she was my bridesmaid at my wedding. But I felt like I was ready. Like I had the desire to put the time in to do the work, and really, I never had that experience before. So it was exciting. Every day was exciting. And I spent every free moment I had trying to learn more when I wasn't at school.
So this really is a passion for you.
It was, yes.
Yeah.
Still is.
Yeah, that's good. Because you're just young in your career.
Yeah.
So when you first got out, in terms of, and I'm asking because I went through some personal challenges. I was also a mature student when I went back to nursing school. When you first started working in your first job, did you have higher expectations on yourself than you would have, say, a 22-year-old who was just coming into the same workplace? Or did you find that you were able to balance out your position in schooling and education in terms of the job?
I think I've always had high expectations of myself, and sometimes too high. But I found I had to balance, because I was way harder on myself than I think anybody else could have been on me. And in my 20s, I don't think I could have done this job. Like, I gave kudos to the girls I went to school with, because even in long-term care, I thought I couldn't imagine myself doing this job at 20. I think at 20 I would have been ready. I really don't feel like I would have.
And that's interesting, because I felt the same. Neither of us went in at 20, so it's really difficult to know if we'd have had a different feeling and outcome had we graduated at 22, as opposed to coming out as an older student. I also felt the same. I'm still in awe. Even as a teacher, I am amazed when somebody who is 18, 19, 20, even 24, 25 knows that this is what they want to do and they can commit to this. I'm like, I am just so impressed.
Yeah, I was the same way. And even the girls I work with, like a lot of the younger ones, I'm just like, wow. And they're so dedicated and they know so much. And it's like, nothing scares them away. They're right in there,
Mm-hmm. Yeah, it's amazing.
Yeah.
So you had I mean, the normal progress through school is that you get that final preceptorship where you can really try and land your first job from. Was that the case for you?
No, because I precepted in the NICU.
Mm-hmm.
I had actually applied for postpartum, like maternity, and they offered me the NICU, and I was blown out of the water. Very excited, and I enjoyed the NICU a lot. I learned a lot, but it just for me wasn't. I guess I didn't feel as passionate about it. Like I learned a ton, and I did apply for some temporary positions, but I think with the lack of experience and being a new nurse right out of grad, there wasn't really a whole lot available. And so while I was in my preceptorship, I literally applied for everything under the sun. I think I had like 6 different resumes going and 6 different cover letters, and was gearing it to anything because I thought whatever comes up, like let's do this. I wanted to get my feet wet and get in there and start doing this. So I think it was the day after our commencement, I received a call from the hiring manager for the surgical float pool at the Royal Alex. So I went in on the following Monday after commencement and interviewed, and she actually hired me that day.
Wow.
So it was very exciting, and it kind of got delayed a bit because I ended up having a gallbladder attack, and the day I was supposed to be starting orientation, I was going into surgery for myself.
How ironic.
Yeah. So it kind of got pushed back a few weeks, but yeah, it was fantastic, and I felt really blessed to be able to like start so quickly because I'd heard previous to finishing school like how much some nurses struggled trying to find a job and went like a complete year with nothing.
Mm-hmm. Absolutely, yeah.
And so yeah, so that's where I started. So I worked on like multiple units, unit 21, which was spinal surgery at the time. I think it's now urology. Unit 32, which was fractured hip, like orthopedic. And then I also got trained in the orthopedic surgery center, which is very posh, and it's all.
I've been. Yeah, I take students there sometimes.
Yeah, it was all elective hip and knee surgery, and then I got to know the staff, and I was lucky enough, like I got to know some of the staff in the orthopedic surgery center. So when they were looking to fill a block booking, the unit manager came to me and said, well, I asked around and everybody was mentioning your name, and so I want to offer you a block booking. And that's kind of where it started. And then I took a temp line there for a year, and then I was still applying because I really had a desire to be in women's, and I don't know what it was about it. I think just because there's so many different, like it's such a broad area and not every patient's the same. So I was applying, and it wasn't necessarily the postpartum aspect because I mean, I've had my kids and they're grown. And so I was like, okay, you know, and then I found out like that is included in it, the postpartum and the women's gynecology. So I ended up getting a temporary line there for a year. And just last June, I applied for a full-time permanent. So now I'm full-time permanent with them.
Oh, that's awesome. That's quite the journey.
Yeah, it's like quite a process, but I hung in there. And
so you always knew that you wanted to be in women's, like even when you were going through the program?
yeah, it was something that I was just drawn to. And
Mm-hmm. So there's 2 things I want to follow up on. I kind of write notes as I go because I'm like, oh, these are good questions. I'm going to forget them. One is after you did your preceptorship in the NICU, that specialty floor, were they looking to hire? Were they offering you a position and you just weren't willing to stay there? It wasn't your fit, or they just weren't looking for anybody?
they were not looking for anybody because I actually had spoken to Daisy Garvey, who's she is the hiring manager for them, and she'd given me her business card. And it was kind of funny because at the time I ended up in surgery, like I got the offer for the surgical float pool. I think it was right when I was starting my orientation, because I was still in orientation. I got offered an interview with the NICU. So I literally had to run from my orientation to the NICU to go do my interview with them. And nothing came of it. And I just thought, you know, whatever's meant to be is meant to be. Like, you know, let's not stress about it. And, you know, you have a job. So.
Yeah, that's so true. I believe that too. I think, and in so many of these interviews that I've done, hearing their story and their journey to where they're working right now, it just seems like there's a lot of, you know, fate. You know, sometimes it's about knowing a person, but that person was meant to be in your pathway to get you where you are today. It's almost like people find their place. It's interesting.
Very, yeah.
Yeah. Fascinating.
I believe that as well.
Yeah, fascinating for me. The second thing I wanted to follow up was, it's not really so much a follow-up as just a note that how ironic that you have to go and be a patient on a surgical floor. And so you have that whole patient side of it that you can now empathize with and connect on in your,
Yes.
that's pretty amazing.
It was kind of unreal because I thought, oh, what crappy timing, but I had struggled for quite a while, so I was like, oh. And it was funny because my surgery actually happened at the Misericordia, and they had student nurses on their unit, and I had a JP drain. So the day I was getting discharged, the nurse had come in, and she had her student with her earlier, and then she kind of asked the student to leave, and I said, if you want her in here, she can be in here, like I don't have a problem with it. So she called her in and let her watch her remove the JP drain, because I thought, like, this is crazy, like 2 weeks ago I was a student, and here we are.
Like literally, yeah.
So
Well, good for you, because not everybody's interested in having students at the bedside, so that's awesome that you were paying it forward.
yeah, definitely.
All right, so NICU into surgery. And you were in the float pool at that time. You mentioned you were on a few different units. So there's some struggles that come with going to different places, working with different people, the way that they like things to be done, the policies. What are some of the ways in which you coped and found solutions to some of those challenges?
Well, I want to say the first month was pretty rough, I'm not gonna lie. Being in the surgical float pool and being a new nurse, this was my perspective, was some of the units you'd go on, because they have worked together for years sometimes, and you're just a casual, so you're not permanent staff on the unit. And sometimes I found it a struggle to get help or have questions answered, because it's kind of like, and I mean, now that I have been doing this for 2 years, I see it. So I try not to be that permanent staff that's kind of like, oh, whatever, it's a casual, and not take the time, just because it's hard. And there were days where I went home and I thought, oh my God, did I do the right thing? Like, am I cut out for this? Because I just wanted to cry, because I felt so overwhelmed, and I felt like I didn't have any support. And unfortunately, on the one unit, the unit managers were changing, so I couldn't even go and have a conversation with that manager. And it was like, oh, I just felt like I was kind of like left out floating. And some days felt like I questioned my own education and my own thought process. So it was a lot of self-talk, to be honest. It was a lot of like, no, you can do this, and like, just keep going and keep asking questions. And literally, and it was like, I spent a month like that, where it was like I literally had to talk myself into it, and like, you know what, you do what you can, and you do the best you can. And if somebody says something, then you deal with it, like, because it can be tough, like very tough.
Did you feel alone?
It definitely
Yeah.
felt alone.
So even though you were on a unit with a team and you were caring for patients, you kind of felt isolated from that team, it sounds like.
Yeah, very. Like, some of the units could be,
Yeah,
just not as welcoming.
you're right. And I have seen that as well as an instructor taking students on the floor. Morning introductions are a really big thing. They set the stage, right? And there's one unit in particular that I go to, there's no conversation. It's all business. You come in, they sit down, they go through a report, and they go out, and you're like, hey, can we introduce ourselves? Can we find out who their buddy nurse is?
Exactly. Yeah.
And so such a weird dynamic to begin with, because the entire day is just the exact opposite. They're very welcoming, and they're very like, come in, let's teach you what you need to know, and we'll show you around. But that morning, just setting that morning up as it would be for any workplace, it's such a crucial period. So if you don't feel like that you have that welcoming right at the beginning, you're not going to feel welcome to talk to them throughout the day.
Oh, yeah, it's it was hard. It was a bit of a struggle.
So other than self-talk, did you find any other ways? Because obviously there's units who are much better at that. I've certainly had students on units where it's been the 180, completely like, yes, who are you? Who do you care for today? This is your buddy. This is your team.
I think the one thing is you kind of have to put yourself out there. So that's what I found, is after a couple of weeks of struggling and feeling like, oh God, is I started to get to know some of the more regular staff that I would see every day, and like try and have conversations with them, even if it wasn't work related, just to kind of get to know them a little better. So I felt more confident going and asking them something if I needed help, or if I had a question. And so that maybe they would remember me when I came for the next shift, or maybe they'd say something to the coworkers like, oh, she's a good worker, or, oh, I know who she is, kind of thing. And it did start to happen. Like, you start to get to know people when you're sent to the same units. But yeah, you really do have to put yourself out there, and it's not always easy. I mean, I think I feel lucky because I am older, so I wasn't as intimidated by doing that. But yeah.
I was going to ask if you feel your age positioned you differently in the sense that you've probably had to deal with things like this already in the past and have had some coping strategies.
Yeah, it's kind of funny because I get both sides of it, in the sense I've gone, like, my new unit when I went on there, and it's almost like they thought I had been nursing for years. And because I am older, and so it's like when they tell you or realize that you haven't been doing it for that long, it's like, oh, well, I would have never guessed. And it's like, I'll take it as a compliment, but it's like, I'm still learning every day, so. And you also have the other side of it where you have younger people. And for me, I felt like, maybe I'm wrong, but I felt like some of the younger staff were almost intimidated, like they thought, and some of the people on our unit have worked together for years and years and years. And I think I surprised them with my reaction to certain things. If I don't know if you allow this, but I could give you an example of a situation I ran into where I had just started, so I was still learning. It had only been a week or so, and I received an email from a coworker, and she had basically given me a rundown of all the things I had missed on my evening shift, and went on to say that there was other nurses that said I had missed things. And in the sense that it was somewhat professional, it was more meant to, I think, kind of knock down my confidence and make me feel badly about the job I was doing. And a part of me wanted to react to how I was feeling at the moment and just spew back stuff. And I thought, this is going to get me nowhere.
Mm-hmm.
So I sat there and I thought about it, and I was really upset. And I thought, like, I've done the best I can, and, like, I get it. Yes, absolutely, I probably missed things. So I thought, how am I gonna how am I gonna deal with this? So I took some time. I didn't answer right away, and then I responded, and I thanked her. That was the first thing I did, and I thanked her for pointing out the things that I had missed, and said, I appreciate the fact that you're telling me, because I can't fix something if I don't know and nobody says anything to me. And I went on and I kept it very positive, and explained I'm still learning and I'm new to the unit. And the only other thing I said was, the only thing I would ask of you is that if somebody has something to say about something I'd missed, I'd appreciate it if you ask them to come talk to me directly, because I can't fix something I don't know about. And I left it like that, but I also CC'd both my unit managers the entire conversation. I didn't add any more to it, and I left it like that. And she responded, and she's like, you could tell that she was kind of caught off guard, because she's like, oh, well, I'm glad you're taking this as a learning opportunity. And she didn't say much more. So I left it alone. And a couple weeks later, my unit manager was kind of swinging by, and we were alone. And I said, I wanted to talk to you about that email I sent you. I said, I believe in being transparent, and I kind of wanted you to know what was happening, and, like, this is how I dealt with it. And she's like, nope. She's like, that was perfect. And that's all we said. And from that point on, I had a completely different reaction from her. When I come on the unit, she tried much harder to be nicer to me. And I mean, that's fine. Like, I don't need to get along with everybody I work with on a personal level. I don't even really need to like them on a personal level, because I can work with anybody, and I can work well with anybody. It doesn't bother me. And for that, I'm thankful, because of my age, because I think that comes with time. When you're okay with yourself and you don't take things personally, and you don't react to them personally, because I find if you take something personally, you're going to become defensive immediately. And that's when the problem happens.
Yeah.
So it's kind of funny, because now it's been just about 2 years on this unit, and I haven't had any more emails. So
you established really great boundaries right off the hop. You probably couldn't tell, but I had like some tears in my eyes listening to that story, because that's my passion, is having people find their ways to create those really safe relationships, but still get your needs met. So as you were telling that story and all the thought process you put into it, I often tell people, like, thank them. It totally throws them off first.
Yeah.
I am kind of thankful when people tell me, even if they're angry with me when they come at me,
Exactly.
I'm thankful that you feel safe enough to talk to me, but now let's structure this in a way that's safe for both of us.
Yeah.
Right? So,
exactly.
Well done, girl.
Thank you. I was very proud of myself after the fact, because I was like, oh man, like 10 years ago, I would have sent back the nastiest email and like been defensive and like defended why, and and I thought I don't need to do that. So
I'm super proud of you too, and I'm just going to pretend I had a little part to do with that because I taught you communication. But I know
oh, you
that's all
did.
you.
You did.
I'm just going to claim a little bit.
You definitely did, Tammy.
That's so sweet. Well done. Well, I didn't want to talk anymore. I'm so happy right now. No. We have so much more to talk about, though.
Yes.
Okay, so surgery, and then you went into, let's jump into your women's. You finally got the call for a women's interview. How did that come about?
I had just been applying, and I seen a temporary full-time, like 1-year lines. So I was like, you know what, I'm going to take a shot. Like, I have some experience behind me now. I do remember some of my postpartum stuff. And so I went in and I interviewed, and later my unit manager said, like, you nailed the interview, because she called me probably about a week later. And she's like, I'm struggling so bad. And the funny thing was, I had come off night shift on the orthopedic surgery center and went to my interview that morning. So I nailed the interview and all my questions, but I failed my med calc test by 1 point. And she's like, I'm really struggling. She's like, but I loved, like, you were awesome in the interview. And she's like, I want to give you a chance. So she's like, but I want you to redo the med calc. So I sat down with the CNE, and of course I nailed every question. And I said, I didn't want to tell you, but I had just come off nights that morning. So my mind probably wasn't, fully there. So
Yeah. Awesome.
But I felt so glad. I was so excited, and I had gotten to know the manager really well in orthopedic surgery, and she gave me a really good reference. And one of my charge nurses that I worked on my line with gave me one. So it really helps making those connections to, carry on. And
Would you recommend, so now you've been through a few different units, and you did have that specialty preceptorship. Like, I get asked a lot by students, is it better to take that specialty preceptorship, or should I go do a medicine? Like, which one do you think would be better? What's your advice now that you've gone through that route?
Looking back, I mean, specialties are great, but I got more experience just going into the surgery float pool or even the medicine float pool. Like, I wouldn't have been the same nurse going into women's if I had taken the specialty. And it really narrows it down. And I think as a new nurse, we all need to get those basic skills down, that patient care and, just the basics before you're going into a specialty. And like, yeah, it's fantastic, but give yourself some experience before you go for it. I think that's the best option.
Yeah. So you found that beneficial, the stuff that you learned in surgery.
Absolutely.
Helped you feel more comfortable in women's.
Yes. And the other thing is like, for NICU, it was so different. I mean, babies can't tell you what's going on. They can't, answer all those questions. So you have to really be intuitive and know what you're looking for. And you don't with a newborn. I mean, I have kids and I still didn't know what, the changes to look for. So.
Gosh, I remember when I had my son, he was 8 weeks early. So he was in the NICU. And I hadn't gone to see him for 2 days because it was just like this foreign entity. And I remember wheeling down there, looking at the incubator going, yep, he's mine. And going back to my room. I'm like, what do I do with him?
That's so funny, because my son was born 6 weeks early and spent a week in that NICU that I worked in. So for me, when I first got there, I thought this is like full circle for me. And the only thing I felt like I could bring to the table is talking to some of those parents, because you start feeling like it's not your baby anymore. Like,
yeah,
it's like,
it's like, how much is that puppy in the window?
Yeah, exactly.
Yeah, really weird experience at first. But after those 2 days, I will just share, once we did the kangaroo care, once we had the skin to skin, that was it. My bear claws were out forever.
Yeah, it's like, yeah, exactly.
Just a weird experience altogether. Okay, so talk to us now a little bit about women's and postpartum. Do you have a preference? Is there one side that you're really drawn to, or you just love everything to do with women's?
I was really drawn to the women's aspect because I spent almost 8 months there before I started getting trained in postpartum. And at first I was like, oh, I hate postpartum when I went over there. And then I stopped and I thought about it and I thought, no, I don't. I just don't feel comfortable. Like, this isn't my comfort zone. And I felt so thrown by it. I was like, okay. And again, I had to self-talk and say, like, okay, give yourself time. And like, you don't like it because you're not comfortable here, but you have to get comfortable. So now I love them both. I don't really care where I go. They're just so night and day. And this might not be appropriate, but I always call them like my life and death units, because like one, you're dealing with like cancers and there is a lot of palliative care. And then the other one, it's like new life. And
Yeah.
the hard part is sometimes you'll see a mom on your one side who's lost a baby. And, if you're lucky in a year, you see her on the other side having another baby,
Yeah. Yeah.
So
It sounds like there's a lot of opportunity for really heavy emotional
oh
conversation.
yeah, a lot. Yeah.
On
And I
both
mean,
sides.
yes. And I mean, there's days where you come home and cry. You can't, we're human. I always say like I become robotic at work because I have a job to do. And like, I can sit with a patient without crying and hold their hand. And there's other times where it's like I have to walk into, a utility room and like shed my little tear and then pull it together and go back. Because, it's hard. It's a tough job.
Yeah. So are these inpatients both? You like obviously the postpartum would be inpatient, but the women's, is that also inpatient or is that outpatient?
The women's unit on 2 West is inpatient, and then there's day surgery on 2 South. So they're just in for day processes and then they leave.
And you work on both of those?
I work on all 3. Yeah.
Yeah. Yeah. So you do get a little bit of mix. So those day surgery patients, a little harder to feel that emotional connection with because they're almost like task nursing. You don't want to say that, but
Yeah,
they come,
it
you
is.
get them prepped, they go, you get them ready to go home, and then the next person comes in. So you don't really get that much time to build a relationship with them, which
Exactly.
is nice sometimes where you don't have to feel like you're taking them home with you.
Exactly. So it's more like get them in, get them out, get it done and go home.
Yeah.
So whereas some of the women on the other unit, it's like they can be there for months. So you do, and you talk to each other and I've had other nurses on the unit who have, reported off and then they'll be like, oh, I forgot this, or how is she doing? Because I felt like something was going on, and they'll, text you and you're like, no, they're good. And you think about them when you go home,
Yeah. Oh yeah, for sure. Now, I know you refer to it as your life and your death unit, but that doesn't mean age, does it?
No, not at all.
So when you're on the women's side, because typically I think of women's health, I think of gynecological issues. So I'm thinking, 50s and up in terms of that kind of stuff. But you do have the younger ladies on that side as well. Is there any particular diagnoses or treatments that are so prevalent that if someone's interested in working in women's, that would be something they could brush up on?
Oh my goodness. Good question, because I remember coming on to 2 West and I literally thought, did I even learn anything in nursing school? Because I'm like, I'm reading the NRC, which lists everybody and like what their surgeries were. And I'm thinking, I have no clue what these things are. Like literally my first day. And I was like, I went home and I like wrote all these things down and I was like researching them to find out like, what the heck is an oophorectomy, self-injectomy, like, what is that? And it's like, I'm a woman, you think I would know this, but
yeah, but we don't walk around calling our body parts and oophorectomy. We don't.
Yeah. But I was like, even in school, I was like, I don't recall ever seeing any of these. And it blew my mind. It literally blew my mind. And it excited me at the same time though. So I think going in, and I was actually just buddied with a new RN and I was training her on 2 West. And I said, it's hard because she had started in postpartum and she's like, well, what's the protocols? And I said, there's protocols for everything. But I said, it's much different because I said, here you can have somebody, two of the same people are having the same surgery. They're having a hysterectomy, but they're completely different. So I said, you just, it's a learning process and you're not going to get it. I can give you tips and what things to look for, but it's going to take time because there's so much to cover every day. Even now, there's still things that I come across and I'm like, what? And it was like, I didn't even know,
Yeah.
a 11-year-old girl born with 2 uteruses. I mean, I didn't even know that was possible.
Yeah.
So,
Wow.
so yeah, it's like mind-boggling to me. Some days it's like, whoa. So
that is what I love about nursing, is that even a seasoned nurse who's been working for 30 years will still find something to learn.
oh, absolutely.
Yeah.
I mean, I'm 3 years in and I think every day I'm still learning something.
Yeah, I hope so.
Oh, yeah.
Because I've been nursing longer and I'm still learning. Oh my gosh. All right, let's ask a few of these questions here that I sent to you ahead of time. I think I sent some of these. Actually, this is good. I don't think I sent this one to you at all. This is going to be a complete surprise.
Oh, okay.
What is the sweetest thing that a patient or family has ever done for you? You off
Um,
guard with that one, maybe.
you did, because we often get like sweets and treats, and this, I mean, doesn't apply to my job now, but when I was in long-term care for my clinical, we were at the general, and there was this like 90-some-year-old lady, and she had been my patient because of course we get to keep them longer when we're in clinical, and her daughter tried to give me this necklace. She had bought this little necklace for caring for her mom, like at the end of the thing. And she brought us in all this amazing, like Chinese food at the end of our clinical, because her mom had been there so long. And it threw me off, because I was like, I'm just like a student. Like I'm just doing what I'm supposed to. Like, so I found it so touching, because I thought, and I guess for me, because I have never been in the position to have to care for a parent in that sense when they are getting older. So she was really appreciative, because it was like, well, this is her most prized possession. This is her mother, so it was very sweet, very touching. And you could tell it was very genuine.
Yeah, that's how you know you've made a real connection and you've made a real difference. And it
Yeah.
often doesn't have to do with the fact that you're a nurse. In my experience, it doesn't have to do with the skills that you know. It has everything to do with the relationship you build.
Well, and the funny thing is that her mom didn't speak English, and they had like a sheet with certain words. I think it was Cantonese or Mandarin that you could use. And you're right, because the majority of my time was spent like doing the everyday stuff. So like helping her eat, because she couldn't feed herself. And like, it took a long time, because she had to build trust, because it would be a new nurse. And then her daughter would come in and like take over the feeding, because she wouldn't eat for us. But just even the attempt to stand there for like a half an hour trying to get her to eat even like a few spoonfuls. And so it had nothing to do with nursing skills or, nursing care, I guess. It was just that one-on-one. And so
Yeah, that's awesome. That's really sweet. So what is the hardest thing about being a nurse? And it can be from any of your domains, because you worked in a few, but what's the hardest thing you have found?
um now being on women's for almost 2 years, I think sometimes those patients that you carry for a long time, like the ones that you lose, that you connect with the families, you connect with them. Sometimes it's hard to let go of. Like, I mean, I have one that I still think about now, and I think about her family and what, how they're doing and how her kids are. And it's, I think it's that thing. It's like you try to remain professional in front of everybody, and it's like your thoughts are still there.
Mm-hmm.
And then, yeah, I
Yeah.
think that's the big thing. The personal aspect, where it's like they're not just patients. It's this
Yeah.
is somebody's mom. And yeah.
So in both of those stories, it's the relationship.
Yeah.
Isn't it interesting? It's funny, as you mentioned that you still think of some of your people. What immediately flashed in my brain, which I haven't thought of for a long time, was my very first long-term care patient when I was a student. And I remember I would, obviously you care for him for so long. And when we were done with our clinical, I still went to see him, and I took my son, and we kind of
Oh,
like adopted him as a grandpa, because we didn't have any family where we were living at the time. This is New Brunswick. And we went for, I don't even know how long, probably until we moved. I don't remember, but we would go visit him all the time.
oh, that's sweet.
Yeah, that is kind of nice to have him pop in my mind today. How random. Wasn't expecting that, Jody. Oh my gosh. All right, so we've covered actually quite a bit of ground there. Is there anything you think, like what would your tips be for nurses who are just starting out?
I think the biggest tip I can give is, well, a couple tips. Don't take things personally. Keep asking questions. Like, even if one person kind of snubs you, go find somebody else, research, use the tools that they give you in your orientation. Don't be afraid to ask questions, and get your time management down, because that is so big. Like, it's the biggest part of it. Once until you're comfortable on a unit, and you know where everything is, and you know what's going on, and you know how the unit itself works and the staff work, go in early if you need to. I mean, I still do it, not so much because I need to, but because I'm very OCD when it comes. I hate being late. It drives me crazy. It gives me massive anxiety. So I go in a half an hour early and I sit there and I grab my papers and I figure out who my patients are, and I have time to chat with some of the nurses that have been on nights, and they can kind of tell me who, before I get the actual report, if anything's going on. I have time to drink my coffee now before I throw on my mask. And just really settle in. So it also gives me time. I'll not only look at my patients, but I'll look at the unit's numbers and what everybody is like, because you could be covering for another nurse. So I like to know what's going on with all the patients, how many ISO patients we have on the unit, and do we have lots of fresh post-ops? Do we have lots of empty beds? Because that'll determine your date. Like, are you going to be running for post-ops? Are you going to be doing a ton of discharges? So I like the extra time, and it's worth it to me. I don't miss things then.
Get your mind set and ready for the day, pre-planning.
Exactly. Yeah.
Well, this has been lovely catching up with you. Thank you so much for spending your time with me and sharing your experience through nursing so far.
Oh, thank you for having me. It's been great talking to you.
Yeah, I really enjoyed it. Thanks again.
No problem. Take care.
Thank you for listening. Be sure to go to the frontlinenursingpodcast.com and sign up for the membership area where you can get the after the recording session and the free downloads. Now, if you have a story you'd like to share, email me at info@tammydunnett.com. I'd love to share your story. Until next time, make it a great day.